What are in this content? 1. What is drug? 2. What is drugs abuse? 3. Effect of drugs abuse. 4. How to stop drug abuse. 5. What will happen if you stop drugs abuse? Chapter 1. Drugs are substances that have a physiological effect when ingested, inhaled, or otherwise introduced into the body. They can be 1. Prescription medications, e.g., painkillers, antidepressants. 2. Over-the-counter medications, e.g., acetaminophen, ibuprofen. 3. Illegal substances, e.g., cocaine, heroin, cannabis. 4. Legal substances used recreationally, e.g., alcohol, nicotine. 5. Performance-enhancing substances, e.g., steroids, stimulants. Drugs can be classified into different categories, such as 1. Stimulants, e.g., cocaine, amphetamines. 2. Depressants, e.g., alcohol, benzodiazepines. 3. Hallucinogens, e.g., LSD, psilocybin. 4. Opioids, e.g., heroin, fentanyl. 5. Cannabinoids, e.g., cannabis, THC. Drugs can be used for medical purposes, such as pain management, or recreationally, for pleasure or socialization. However, drug use can also lead to addiction, health problems, and legal issues. Drug abuse, also known as substance abuse, is the excessive and harmful use of drugs, including 1. Illegal drugs, e.g., cocaine, heroin, cannabis. 2. Prescription drugs, e.g., painkillers, sedatives, used without a prescription or in excess. 3. Over-the-counter drugs, e.g., acetaminophen, ibuprofen, used in excess. 4. Legal substances, e.g., alcohol, nicotine, used excessively or irresponsibly. Drug abuse can lead to 1. Physical dependence and addiction. 2. Health problems, e.g., organ damage, infections. 3. Mental health issues, e.g., depression, anxiety, psychosis. 4. Social and relationships problems. 5. Financial and legal troubles. 6. Impaired cognitive function and memory. 7. Increased risk of overdose and death. Signs of drug abuse include 1. Increased tolerance, needing more drugs to feel the same effect. 2. Withdrawal symptoms when stopping or reducing drug use. 3. Loss of control over drug use. 4. Neglecting responsibilities and relationships. 5. Continuing drug use despite negative consequences. 6. Preoccupation with obtaining and using drugs. 7. Engaging in risky behaviors, e.g., sharing needles, driving under the influence. If you or someone you know is struggling with drug abuse, seek professional help from a medical provider, counselor, or addiction treatment center. The effects of drug abuse are far-reaching and can have significant impacts on both society and individual health. Effects on society. 1. Increased crime and violence. 2. Economic burden, e.g., healthcare costs, lost productivity. 3. Strained relationships and family dynamics. 4. Increased risk of accidents and injuries. 5. Reduced community cohesion and social capital. 6. Normalization of drug use among youth. 7. Increased healthcare and social services utilization. 8. Reduced economic growth and development. Effects on human health. 1. Physical dependence and addiction. 2. Organ damage, e.g., liver, heart, brain. 3. Infectious diseases, e.g., HIV, hepatitis, from shared needles. 4. Mental health disorders, e.g., depression, anxiety, psychosis. 5. Cognitive impairment and memory loss. 6. Increased risk of overdose and death. 7. Nutritional deficiencies and malnutrition. 8. Increased risk of chronic diseases, e.g., diabetes, cardiovascular disease. 9. Impaired immune system function. 10. Reduced quality of life and well-being. Preventing drug abuse in society requires a multifaceted approach that involves individuals, families, communities, and governments. Here are some strategies that can help. 1. Education and awareness. Educate children and adults about the dangers of drug abuse, its effects on health, relationships, and society. 2. Family support. Strengthen family bonds, encourage open communication, and provide a supportive environment to prevent drug use. 3. Community engagement. Organize community events, campaigns, and programs to raise awareness and promote drug-free lifestyles. 4. Early intervention. Identify and intervene early in cases of drug use, providing counseling and support to prevent addiction. 5. Treatment and rehabilitation. Provide access to effective treatment and rehabilitation programs for those struggling with addiction. 6. Law enforcement. Enforce drug laws and regulations, and provide support for law enforcement agencies to combat drug trafficking. 7. Alternative activities. Provide alternative activities and hobbies for individuals, especially youth, to engage in. Reducing the likelihood of drug use. 8. Mental health support. Provide access to mental health services to address underlying issues that may contribute to drug abuse. 9. Drug-free environments. Create drug-free environments in schools, workplaces, and communities, promoting a culture of drug-free living. 10. Policy and legislation. Develop and implement effective policies and legislation to prevent drug abuse, including restricting access to drugs and punishing drug-related offenses. 11. Media campaigns. Utilize media campaigns to raise awareness and promote anti-drug messages, especially among youth. 12. School programs. Implement evidence-based drug prevention programs in schools, focusing on skills development and positive relationships. If you stop drug abuse, you can expect numerous positive changes in your life. Here are some potential benefits. 1. Improved physical health. Your body will begin to heal from the harmful effects of drugs, and you may experience improved overall health, energy, and well-being. 2. Mental clarity and focus. Your mind will clear, and you will be able to think more clearly, make better decisions, and improve your concentration and productivity. 3. Emotional balance. You'll experience more stable emotions, reduced anxiety and depression, and improved mood regulation. 4. Better relationships. Your relationships with family and friends will likely improve as you become more present, engaged, and responsible. 5. Increased self-esteem. You'll develop a more positive self-image and confidence as you achieve milestones and regain control over your life. 6. Improved finances. You'll save money previously spent on drugs and potentially improve your financial stability. 7. New hobbies and interests. You may discover new passions and interests as you explore activities and pursuits that don't involve drugs. 8. Personal growth. You'll develop resilience, self-awareness, and a stronger sense of purpose as you overcome challenges and work towards a healthier life. 9. Reduced legal problems. You'll avoid legal troubles related to drug possession, distribution, or other drug-related offenses. 10. A sense of accomplishment. You'll feel proud of yourself for overcoming addiction and taking control of your life. Remember, quitting drug abuse is a journey, and it may come with challenges like withdrawal symptoms or cravings. Seek professional help and support to ensure a safe and successful recovery.